here for another episode of our Rational Wellness Podcast. It's confusing to know what you're supposed to do to be healthy. What should we be eating? How should we be exercising? Should we be avoiding red meat, cheese, and butter? Should we be putting butter in our coffee? How should we be exercising? Should we be taking calcium supplements, or are calcium supplements harmful? Should we take fish oil? Is fish oil harmful? My goal is to bring clarity to some of these issues using the top scientific research and interviewing experts in the field who can help us understand some of these issues. Please subscribe to the Rational Wellness Podcast on iTunes, Stitcher, or YouTube. So let's get started on your road to better health.
The hope was so enticing back in the days, crazy.
Hey, Rational Wellness Podcasters. Thanks for joining me again today for another episode of the Rational Wellness Podcast. And we have a great guest with us today, Dr. Karlis Ullis, and we're going to discuss men's hormonal and sexual health. And so let me give you a little background about Dr. Ullis. Dr. Karlis Ullis graduated from the Washington University School of Medicine in 1970, and he's established himself as an expert in sports medicine and also in male hormonal health. Dr. Ullis was a doctor for the U.S. track and field team in the 1984 Olympic Games in L.A., for the El Salvador Olympic team in 1988, and also for the Latvian Olympic Games in the Latvian Olympic team in 1992 and 1994. Dr. Ullis is on the scientific board for the Journal of Rejuvenation Research, and he's published a number of scientific papers. Dr. Ullis has written a number of books, including Age Right, Turn Back the Clock with a Proven Personalized Anti-Aging Program in 1999. He also wrote Super T in 1999. He also wrote Hormone Revolution Weight Loss Plan in 2003. And Dr. Ullis is now writing Super T, Doing Testosterone Replacement Therapy Right. Dr. Ullis, thank you for joining me today.
Thanks for having me here.
Absolutely. So we're going to talk about male hormonal health. And it's well known that testosterone levels in the United States have been dropping for the last 20 years or so, somewhere around 17%. What do you think are some of the reasons why testosterone levels have been dropping?
You know, what's very interesting is that if you look at obesity is the number one cause of low testosterone. 40% of obese people, especially in the visceral adiposity area here, is a major cause, like 40 to 45% will have low testosterone. So therefore we have this huge epidemic of obesity and low testosterone, diabetes, and that is like the number one cause. Number two is probably what we call in terms of cause would be the comorbidities, like all the different things that people get with being obese in terms of not exercising, bad nutrition, bad lifestyle, poor food, pollution, and so forth. Those are, and then I would say the third thing is kind of like a functional low testosterone, which is, well, you just don't have a good lifestyle. You don't sleep, you don't eat, and all of those contribute to low testosterone. But there is actually three types of low testosterone that everybody should know. There's primary low testosterone, which is loss of testicular function. Number two is actually, we call this secondary low testosterone, which is the pituitary gland is not sending signals to the testes to release luteinizing hormone and testosterone. And number three is actually called functional. And then the functional part is the one that is lifestyle. And so you have these three. Most of the time you don't see endocrinologists talking about functional low testosterone. I just saw a paper recently, which is very well done by people out of Seattle, University of Washington, and they had a whole study done on looking at treating the comorbidities of people, and if they could exercise and lose weight, could they alter their testosterone levels?
So what was the conclusion?
Well, the conclusion was if you're a younger male, probably you could be successful. But then to take a sedentary 50 to 60-year-old male who's overweight, has metabolic syndrome, difficult to change what we call the comorbidities.
Right.
And however, then later they added testosterone and lifestyle change, and these people did get better.
Great. What are some of the causes of primary low
Well, the
testosterone?
primary is like you have your testes are damaged. I mean, your Sertoli cells and Leydig cells are damaged either by infection, trauma, or maybe genetically. You have a problem or even a cancer.
Okay.
So basically, those people are committed to a lifetime of testosterone replacement therapy.
And then what was the second one you mentioned?
Well, the second one is hypothalamic pituitary gonadal axis disturbance. Your hypothalamus kind of reads your environment, and if you're not sleeping...
And the hypothalamus is this gland in your brain that sort of signals the other hormonal organs to act properly, right?
Correct. It tells you, right now we need to have some more testosterone. So testosterone is made in males mostly during the night. So it kind of turns on the mechanism of releasing LH. It's called gonadotropin.
LH is
luteinizing hormone, right? And luteinizing hormone goes down to the testes, signals the Leydig cells to produce testosterone.
Right.
And then you also have FSH, follicle stimulating hormone.
Okay.
Then there's another signal process via the hypothalamus. But if the hypothalamus is somehow injured, like maybe trauma to the head or even lack of sleep or opiate use,
Okay.
you will shut down testosterone.
Interesting. So in terms of, we're talking about some of the functional causes of low testosterone. What do you think about the role of endocrine disrupting substances or estrogenic substances like pesticides, like bisphenol A, which is found in plastic bottles, in all the estrogenic substances in personal care products like sodium lauryl sulfate? What role do you think these play in affecting testosterone levels?
Well, it's kind of interesting because we just had a recent study released showing a 40 to 50% decline in sperm levels. And that's about over 40 years. It's a
Okay.
huge amount of, and why is that? Well, it is probably all of these pesticides, endocrine disruptors that you're talking about.
Right.
And testosterone and sperm kind of go together. You don't have testosterone, you don't have sperm. You need testosterone to be fertile. Now we're getting infertility because of the endocrine disruption. And the endocrine disruptors that are out there are estrogenic and anti-androgenic. All of nature is pro-estrogen. All plants are more or less neutral or pro-estrogen. There's not a single plant on the planet which is androgenic. There were a couple thought
why
that
that
were.
is. It's kind of interesting.
Well, it's because we want to preserve the species. We want to maintain fertility and make sure the females have enough capacity to reproduce. So here on one end we have all this excess estrogen. So when we talk about these disruptors, really we talk about estrogens and anti-androgens. So we're kind of getting a problem of women want to reproduce, but there's not enough sperm. There was a very good editorial by Dr. Basine, who runs a clinic in Boston University, one of the very well-known doctors in endocrinology. He says we're heading towards a sterile world. And if these statistics are true, then it doesn't look very good.
Interesting. A sterile world, huh? Well, do you think that it's inevitable? So putting aside these, what do you think that there are ways to get rid of these endocrine disrupting substances? What about detoxing your liver?
Well, you can, but I mean, everybody carries a certain amount of burden, like
Right.
the BPAs. I mean, virtually everybody, if you were to measure them,
Right.
has some BPAs in their system.
Right, but certainly you can lower your levels by avoiding use of, plastic water bottles and BPA lined cans and, et cetera, et cetera.
Well, I think that,
Eating organic.
the more you're eating non-processed foods.
Right.
So that's the key number one. Do not eat anything processed. Once it's processed, you've got a problem. You don't know what kind of food you're getting. The more you can grow your own food, even better.
Right.
But I think I do not like people to clean their house with chemicals.
Right.
And that means you've got exposure day and night of chemicals.
Right.
And so therefore, all of these Swifters and other things that people are advertising, and also the detergents that are used to wash clothes.
Yes.
Of course, people use it, but they advertise it like so heavily, and you got this wonderful detergent, that wonderful detergent.
Right.
But my God, those are full of chemicals that disrupt our endocrine system.
Yes, absolutely. And most people don't realize this, but most household cleaning products do not even put the ingredients on the label. They're not required to.
Which is horrible.
Yeah, so you really need to use non-toxic cleaning products that say on the label, no sodium lauryl sulfate, no, toxic products in them. You need to do your research, go to the Environmental Working Group, which is a great resource for looking up which products are non-toxic and try to utilize those products as much as possible.
Now, I think in terms of liver detox, there's several systems out there, Metagenics and Designs for Health and other people, other supplement makers. The one I like is actually the 4R program from the Metagenics.
Okay.
And it's remove the toxins from your gut. That's
Right.
number one.
Yeah.
Number two is replenish the gut and then replace it with good bacteria.
Sure.
So this leads to the issue of my contention is one of the problems of low testosterone in sperm is gut microbiome is screwed up, so to speak.
Yes.
That you have to get a good, and there's so many people being treated for SIBO, small intestinal bacterial overgrowth.
Yes.
Treated with tons of antibiotics over and over, but yet we know that the treatment is fecal transplant. You basically clean out all your bacteria, get some of these good bacteria, put it into little pellets, and maybe put them as suppositories. And there's been a good scientific literature to support that boost your immune system, boost your liver, boost everything.
Yes. Well, actually, probiotics have been shown to be beneficial for treating small intestinal bacterial overgrowth / IBS.
Mm-hmm. Right.
Yeah. Yeah, no, there's really some really interesting research on fecal replacement, and Dr. Perlmutter has talked about its benefit for chronic degenerative neurological diseases and really some amazing stuff. Unfortunately, it's only approved right now in the United States for Clostridium difficile infections. But, there's a lot of research ongoing in that regard. But
Well, I've seen a couple of YouTubes where people kind of show you like a home way to do your own fecal transplant.
right,
And
I
they give you a recipe.
we don't recommend that.
Well, it's not, what I'm saying, but
Yeah.
you could theoretically do your own, but you have to
Right.
watch and, you got to kill off all your bugs that you've got, make sure you're really sterile in terms of bugs,
Right.
and then get rid of it, and then put the new stuff in. So it's really, you have to be really precise, and
Right.
you could maybe screw yourself up if you do it wrong.
Yeah. Okay. So, do you think there's any way? Do you think that a man, if he eats healthy, leads a healthy lifestyle, avoids endocrine disruptors, takes appropriate nutritional supplements, exercises the right way, manages his stress, has a happy life, can a healthy man maintain healthy testosterone levels the rest of his life?
I would say about 25 to 30% of men will go through a lifetime and have normal testosterone levels. But if you look at this one curve done at the Baltimore longitudinal study, it showed total testosterones kind of were scattered, but if you look at the free testosterone levels, they just decreased over time. But there was a good 25-30% of men who were able to do that. But you have these comorbidities. You may have cancers, you may have heart disease, you may have diabetes along the way, which shoot down your testosterone.
I see. Are there any natural supplements that you think could be effective at raising testosterone levels?
Well, there's nothing directly, but indirectly, we have to understand the concept of aromatization.
Right.
Aromatization is very important
Okay.
because that's the only way the body gets estrogen. And females need some
So
testosterone.
aromatization is when the liver takes testosterone and converts some of it into estrogen?
Correct. And so there are drugs out there for women with breast cancer, so they don't produce any estrogen. Anastrozole, letrozole, exemestane. So, but you can also use some anti-estrogen supplements. Like for instance, it could raise. What it does is just inhibit the aromatase enzyme, and some of those substances are like vitamin D. You want to keep your vitamin D up around 60, 70. Zinc about 30 to 60 milligrams.
Okay.
Ceruloplasmin measured to make sure you don't have excess copper. Turmeric curcumin has been used and studied. Resveratrol, selenium, magnesium is very good. Your inositol would work as also. So these are just some nutrients which I think are helpful to help those people by knocking down the aromatization process, which means probably knocking down sex hormone binding globulin. Sex hormone binding globulin is a really hard thing to treat because we don't have one direct treatment because the liver has been insulted somewhere in your lifetime.
So men who have elevated levels of sex hormone binding globulin, this is a substance that binds with testosterone in your body and makes it harder for your body to utilize it, so you have lower free testosterone levels, correct?
Correct. So what you use is called the bioavailable free testosterone. That enters the cell. Otherwise, I've seen patients with like a 800 or 900 level of total testosterone, and they may have a 30 level, which is very low, of free. So they're basically, when they're that low, they will exhibit hypogonadal symptoms.
Okay, and hypogonadal means the symptoms of low testosterone, basically, right? Which is lack of energy, difficulty building muscle. What are some of the other symptoms?
Well, I think that probably the first symptom is low sex drive, libido, sexuality, and then you have also fatigue and muscle and energy. I mean, those are probably energy. Libido is number one, and then lack of energy. And then erectile dysfunction can go with that as well.
Okay, great. How do you deal with elevated levels of sex hormone binding globulin that produce this?
Well, I mean, I haven't used this new program because I just went to a conference recently, but I have several people using boron, stinging nettle root, a really good concentration, and also supplemental.
Interesting.
And I have these people that have drawn out charts, and it shows when they use this particular program, it seems to drop their levels. But I'm going to start using a little twist on that. So I'm experimenting on finding the right cocktail to lower your sex hormone binding globulin, and that would make a lot of men happy.
Great. So for men who choose to use testosterone therapy, what are the risks in terms of cardiovascular disease, and if there are any? Because there have been quite a bit of controversy in the literature. Some of the papers seem to show that there is an increased risk of cardiovascular disease with taking testosterone, and other papers and even systematic reviews show there's not a risk. And then if there is a risk, how can you best manage that risk?
Well, first question being, until about 2 years ago, it was more or less thought that low testosterone was bad for the heart. Then 2 papers came out in JAMA, one a year ago, one the year before that, one in JAMA, one in PLOS, and it showed using testosterone gel, 1%, 50 milligrams a day, for a year, actually made people have increased rate of cardiovascular events. Those papers have been analyzed by a lot of other scientists, have been more or less discredited as being true. The most recent paper that came out in JAMA by Budhoff, a doctor here at Harvard, he is an expert in the CT scans of your blood vessels for plaque, and he's shown that testosterone will increase fibrous plaque. What that means, we don't know. We just know that it increases fibrous plaque. So it's something also about excessive exercise increasing plaque. So plaque is really kind of a interesting. I have all my patients if they come in and they got a family history, I have them all do a plaque test. If that plaque test is over 100 or 200 units, and a lot of calcium all over. And I do a carotid scan to see if there's plaque there. And I sometimes do the femoral arteries, and if there's plaque there. And then I have to, I do the MESA score, and that is the multi-ethnic score to see what's your risk of a cardiac event over 10 years. If that risk is over 10%, and you need to take a drug, or you got to do something to lower your levels. And there's a few books out, like Azelstein has a book on how to reverse heart disease, and there's other people who have, but these people, there's no oil allowed of any kind, and it's all plant-based diet. And that seems to work in some people very well, but not everybody.
Interesting. Should testosterone be prescribed for men who either are at risk for prostate cancer, who say have an elevated PSA or an elevated family history, or what about men who already have prostate cancer? Is it risky if they have low testosterone to use testosterone replacement, given the fact that men with advanced prostate cancer, where the cancer is spread, are often given drugs that block testosterone levels in the thought that testosterone leads to the spreading of prostate cancer?
This is the old Huggins theory that, testosterone is like pouring gasoline on a fire. That was a study of really only one person. And so, but however, the whole world became enamored with this urological world, with this concept that gasoline and testosterone is the gasoline, and then boom, prostate cancer. That's been disproven.
Okay.
Now we have what's called the saturation theory, that the prostate gland can only absorb so much testosterone. Once its level is filled up, so to speak, anything above and beyond that just floats around in the blood. So the theory of higher testosterone, more chance of having cancer, not true. However, it's low, more likely to have cancer. So low testosterone is worse. So most urologists and oncologists like to have people in eugonadal state, which means having a normal testosterone. And I do treat patients who have had either or do have Gleason scores of 7, but they're being followed via the new technology of MRI and biopsies. And MRI can really pick out where your lesions are, and biopsies are, and then you follow them, and the urologist maybe does another MRI in a year. And so we have new tools to follow people, what we call active surveillance, to make sure that testosterone we're using is not doing you harm.
Cool. So for men who need testosterone replacement and who choose to do it, what's the best form to use? What do you like to use? Do you use the gels? Do you use injections?
It depends on the family situation. If you've got young kids around, you don't want to use the topicals.
Okay.
There are some that you can put on your armpit.
And that's because if you put it on your arm and the kid touches your arm, he'll absorb some of the testosterone.
Get into precocious puberty, or some androgenic effect might affect their fertility in the future, right, and so on. So you don't want that. So therefore you have that. You can put it under your arm. There's one you can put it inside your nose. It's a nasal delivery. And so you have these delivery, and there's even a buccal testosterone. But those, probably the two most popular ones are either the gels, when you don't have contact issues, or the injections.
Okay.
And it seems like right now that if you have a bone problem in terms of osteoporosis, injectable testosterone is better than topical. You'll get more bone density, especially your spine and the hip, with injections. The newest trend is subcutaneous injections of testosterone, cypionate.
Okay.
And that means you take, I use patients a 25 gauge needle, 5/8 of an inch, and have them inject their testosterone into the muscle in a direction which is not straight into not muscle but fat, but kind of a parallel like this.
Yeah.
And that's not painful hardly at all. And that has been proven to be equal to, there's just a study in JCM, Journal of Clinical Endocrinology, that people who injected here in the lateral thigh, right in the muscle, versus this, at the same levels.
Interesting.
So this is much easier than people get really sore and tired of injecting into muscle. The old form is injecting the buttock, and people aren't doing that anymore.
Yeah, I think the bodybuilders are still doing that. But
Well, they do it because it's sort of tradition, you know. I mean,
Yeah.
a lot of the bodybuilders are sort of, in a way, traditionalists. I mean, they still, you know, I mean, they don't live very long because they're
Yes.
eating red meat like crazy, and we know that doesn't, you know, live long.
yeah, plus these guys are like really abusing.
Oh,
Yeah,
they
well,
have to get. I
steroids.
mean, when I used to go to Gold's, I mean, and now I go to a Y near my house in Pituitary. But those guys get muscles. You know, I mean, I see natural bodies, but then they get so big. There's no way you can get so big without chemical support,
Yeah,
illegal chemical support.
yeah, yeah. I've seen lots of professional bodybuilders end up needing kidney transplants and dying of heart attacks, and you often see them in the gym and they're all red, and you can just tell that they're, you know, walking time bombs.
That's true. That's true. I mean, you're sacrificing your life for what? That's a good question.
Yeah,
I mean, so we do have this dysmorphic problem in our culture where everybody thinks they're too small, that they're not big enough in terms of their muscles. And if you get muscles don't pop out, you got to inject something to make them pop out. And same thing as anorexia. Like women think they never are too, they always think they're too fat. And men think they're too thin. So that's our society.
yeah. Lots of problems with the images, but we're here to project positive images and help people to feel better about themselves by teaching them how to eat healthy and exercise properly.
Right.
Yeah, it seems like a lot of the MDs prescribe this androgel, and I know you're not very big on that. You don't think that's very effective.
Well, Androgel right now is, because it's a very expensive drug, it's probably, you have to use the 1% generic form. It does produce levels, you know, which are sufficient. And if you use it every day, but, you know, you have to rub it on your shoulders, on your arms, and sometimes I even have people put it on their face after showering. It's so alcoholic, so it might burn, but you get better penetration. But if you really need to build, I mean, the biggest thing with aging is also muscle loss and bone loss. It will not build bones as well as injection do. So, I mean, but if you're very old and fragile, I don't like you to use I like to use topicals or other injectables, because too much testosterone in an older, frail person can be dangerous.
Interesting. Okay, great. This is a very interesting discussion, Dr. Ullis. I appreciate the fact that you really put a lot of thought and really delved deep into the research on this. And that's unlike you know, some doctors I know who are prescribing testosterone often without even testing to see if the patients are low, and you know.
Very good.
So for patients and other practitioners who'd like to get a hold of you, what's the best way for them to contact
Well,
you?
you can just email me at kullismd@gmail.com. That's just email me, and
Or they can go to your website?
or go to my website, drkarlisullis.com, or you can go through Excel Mail and answer questions on that site. So anyway, kullismd@gmail.com.
Great.
Thank you.
Thank you, Dr. Ullis.
Thank you very much.
Sure.